2 months of summer are down, and this is the final stretch. I think my daughter has about 3 more weeks until school starts again, so I can't believe it's gone that fast. I think everyone has been very busy. I know the state fair was a huge endeavor, and everything got broken down earlier this week. We had a couple of missing iPads that have thankfully been located. Doug made a special trip, I think, to the fairgrounds and found a couple of them that had been stashed aside. So I think overall we can call that successful. And I wanted to start off with some state fair recap. I'm not sure if I've seen Michelle Wofford join us yet. I'm not sure if she's able to today, but she did send Dr. Rogers and I a screen or a Google Doc the other day. So hopefully you guys are seeing this. It says State Fair Debrief. And this summarizes the number of gift basket entries that were received each day that we had visitors at the fair. So it was a total of 1,342. She made some notes though, and I noticed this certainly while I was working there on Thursday, that sometimes you interacted with people and then they would walk off without putting an entry into the gift basket. Sometimes people would just beeline right over there and somehow intuitively knew what to do and put an entry in and never said one word to us. And some staff kind of didn't as much as others try to engage with folks. So that's probably not a great metric for determining exactly how many people we engaged with at the extension exhibit, but it's a number to start with. So 1342 is what we've got for this year. There were also 22 Ask an Expert paper questions written down where people were there. I know I got an Ask an Expert question entered online, and I'm not sure if that was somebody who had been chatting it up while they were at the fair and someone told them to go ahead and jot that in. So I did get an email. So I had to go into the Ask an Expert system to reply to that. And just speaking of Ask an Expert, I think in September, we're gonna talk about that a little bit more with Christy Mannering and refresh everyone's memories of how the Ask an Expert system works, with who are the wranglers, who are the experts, and who should be in the system and how that process works. So now back to the state fair. Some of these notes here are other observations that Michelle Wofford jotted down for us. These were things that I think some people commented to her own observations. I think there was something about, I think this should say Wi-Fi, not MiFi. Worked great considering connecting the 4 monitors to the internet next year. We did get we had 2 new screens this year, the large screen that had the story map on it, and then one of the screens with the videos. So the new one does have the ability to connect to internet. As I had said before, some people entered for the gift basket without really interacting. I think people like the idea of having some sort of game, the spinning wheel, something that's a little bit more interactive and gamey-like. So that's something to consider for next year. And other people had commented they really did like having the Ask an Expert where we had that podium set up and they can comment and type in their questions for us right then and there. There was a suggestion to have better integration with what the Master Gardeners are doing and having more Master Gardener and Master Food Educator demonstrations taking place, I assume in that demonstration area. So if we keep going with the story map next year, we probably don't need to use the iPads. I think that ended up being a stress, was worrying about where the iPads were and if they were going to walk off with someone else who thought that was a really excellent giveaway. And I know that really that they weren't used when I was there on Thursday. So I'm not sure if anyone else who is online this morning has thoughts about that or any other feedback from the fair. Certainly, if you want to share your experience, please unmute yourself. We have a couple of minutes where we can talk about this. If you really would prefer to just write your thoughts down, you can go ahead and enter that into the chat box too. So if you want to get a chat box going on fair feedback, that would be really great and something we'll gather and pass off to the next planning committee for the 2019 State Fair. And apparently the 2019, in 2019, that will be the centennial. So we'll be celebrating 100 years of the Delaware State Fair. Michelle Wofford has also pointed out, she's been involved with this for many years and an integral component to our exhibit at the fair, that she's very likely not going to be in Delaware during the State Fair next year. So we're going to need to have a good team of people who will head this up and make sure we have a good exhibit that's interactive and engages with the public. So some of the other comments, few handouts taken. People really did like the bags. I know I was trying to stuff the bags on the fly because they weren't pre-stuffed with some of our handout materials that we had there. And I know it kind of got annoying having to restart those videos, and people were getting confused by the remote control. So the one new TV does loop automatically. So maybe that's something in the future as old TVs go, we update them with more sophisticated technology that could be less cumbersome. So anybody have comments? I do see some chats popping up. Oh, so Extension will have its 105th birthday. That's right. Yeah, that'll be 100 and 105 for us. And then pre-stuff the bags as possible is Nancy's comment. That was to me. Great job to the volunteers. So I agree. Yeah, the bags seemed to go fast, and sometimes the bags were out there empty, and sometimes they were full. So I tried to show people that the story map web link was one of the handouts in the bag and encourage them to go visit it later on. So we'll have to find out by doing some checking on like Google Analytics if we had some traffic to our story map by outside visitors after the fair. So any other comments or thoughts on State Fair? No? Okay, I'm gonna then switch gears. Oh wait, I just think something just popped up. Maria, one way to encourage people to interact rather than just enter and walk away is to have staff hold on to the entry slips and hand out rather than leave on the table. Yeah, that's a good point. Cheryl shared one master food educator volunteer suggested that the former BARM theme seemed to resonate more with visitors, and the comments connecting us to Delaware Electric Cooperative continued. So I know that was one thing that Michelle offered that drove her nuts. It's kind of funny, but we certainly don't want to be confused with them. And, you know, the BARM theme, I think the idea a couple of years ago was it was just getting kind of tired and worn out looking, but certainly every couple of years I think we'll want to refresh it, so maybe we'll go back to another barn in the future. Sarah, many people made comments about how much they liked the bags. A few people actually came up to the table to talk to me because they wanted one and then started a conversation. But that was nice of them, Sarah, because I had people that just came right over and took a bag and walked away without saying anything to me. So I think if you can grab them while they're there, that's great. And I agree, Nancy, I think the story map was great. The credit card sleeve, nice piece to also encourage Ask an Expert. So Maria, your comment about adding the UD and DSU logo, is that to the exhibit area itself? Yeah, that's a good idea. And I don't see why they couldn't if they can find the room to squeeze them in. And I don't think the logos are that big, they couldn't do that. All right, well, good. I think if you guys please go ahead, we'll save the chat. And I'll just go ahead and switch gears and move on. I want to give a quick update too about the needs assessment process. As I've been sharing in the DW, we've gotten the report from the Community Center for Research and Engagement. We then got the leadership teams from both UD and DSU together to review the report and talk about how that might be impacting our plan of work. And so I'm gonna share my screen again. Hopefully now you're seeing my PowerPoint presentation. This is the summary slides we put together and what Dr. Rogers is going to be sharing with the Dean's Committee in a couple of weeks. They're having a retreat. And so overall, I had noticed this and pointed this out, I think, in some of our DWs as the survey was out, that our demographics were not completely representative of the state of Delaware general population, which was what we were really trying to reach. We did have good spatial distribution, so about the same percentage of respondents from each of our counties as people who live in each of our counties, more in Newcastle County than in Kent and Sussex. That's where most of the population is. Newark and Dover had the highest response zip codes, and then there were sectors along the beach corridor, parts of Wilmington, and parts of Kent and Sussex that had lower response rates, but pretty good distribution across the state. Those that responded to our survey were tended to be older in the age distribution than the general population, primarily female. We definitely had more women than men, more white, non-Hispanic respondents than those that are non-white and Hispanic. Our responses were from more educated people than the general population of Delaware. We did have similar employment status, but then higher household income. So this, we know a lot about the people who responded to our survey, and this is something we can work on in the future, is trying to make sure that we're hearing from the rest of the population and hearing what their needs are. So those are things we can work on in future needs assessment surveys and through our outreach all year. When you look at the relationship to cooperative extension, we did have one question to try to figure out where these are internal stakeholders or external stakeholders. We were pleased that about 20%, that neither, the gray category, had no prior experience with UD or Del State extension programs. So that was the snowball effect. We got those people who weren't familiar with us. Primarily, though, people were more familiar with UD than Del State, but we had a good chunk of folks, almost a third, who had familiarity with both of us. 19% had used Ask an Expert in the past. 30% of the respondents were some sort of volunteer of ours, either through Master Gardener program, 4-H, and then there were still some MFEs in there as well, and others. If you look at the state level issues, if you remember, we had state level issues, community level issues, and then sort of that individual level. And where the individual level is really what did individuals think should be priorities for research and training. And at the state level, and really across all boards, everybody thought something was important. Some level of the respondents, usually above 50%, thought all of these issues were important. But some things rose above as being very important. And so looking at the state level issues here, ensuring the availability of clean water. 93% of the people who responded to the survey thought that was very important. Keeping communities safe from crime, managing natural resources sustainably, and then it goes on. At the community level, we had 4 different categories of questions. Ag and the environment, these are the responses here. Again, everything on average came out as, for people who rank this as very important, 62% or more. So preserving farmland and open spaces came in at the top there at 83%. In the economic development category, here, understanding the importance of ag to our economy and access to job training or employment were the 2 highest issues that were ranked as very important. But again, everything had at least 50% or more. For leadership development, the 2 that rose to the top were exposing youth to science, technology, engineering, and math topics, and training youth and adults to think critically and use problem-solving skills to make decisions. And then for the health issue area, really these top 3 were in the 80% range here: access to mental health service, caring for the elderly and disabled, and access to primary care doctors. So these were all things that the leadership team started to look at. For the issues that were ranked very important, priorities for research and training, we had some 2 categories for the individuals to rank: parenting, job skills, prevention of substance abuse, and financial management practices. I think that's for individuals and businesses, were the highest ranked areas. Most of the rest came out somewhere less than 11%, putting them into the very important category. And then we had 2 categories for people to rank, 2 groups for people to rank for farm topics: conservation and soil health practices, nutrient management, impacts of environmental rules on agriculture, IPM, and farm business management were the 5 that rose to the top in those categories as being very important when they had to sort and rank those items. So we also got some information on how our respondents like to learn. They predominantly said they would prefer to attend a seminar or workshop or search internet sites. It was interesting though, the center who did the analysis for us, in addition to all of those other issue areas, broke out the learning preferences by age cohorts and all of those other demographics. So we have a lot of data within the report if you haven't had a chance to look at it. But here's where you can see, depending on someone's age, oops, I'm sorry, I was trying to move the picture grid. It really impacted how they prefer to learn. So this is something that we can keep in mind as we go about planning our programming and who our target audiences are, whether we're working with younger age groups, or if we think it's going to be an older age group, we might decide we want to do something more with videos for the youngsters and in-person meetings for people who are more mature. So the leadership teams at both institutions took all of this information and we started to talk about how this might be impacting our plans of work, along with other information that we know about our strategic initiatives at both institutions. So in this table here, the blue column is the unique strengths, the 5 unique strengths for the College of Ag and Natural Resources. This light yellow column are the present plan of work areas that you should all be very familiar with. The light green area over here are the 4 NIFA plan of work areas that we aggregate our 9 up into when we do our federal reporting. So this darker gold color is what we're proposing for changing. So what we plan to do here is do a little bit of merging and renaming to reflect the needs assessment results. So we plan to merge best production management practices and local urban food production and access into one plan area. We're going to call it what we've been calling the NIFA plan area, Sustainable Production Systems for Urban and Agriculture and Urban Landscapes. And then for nutrition and health promotion, we're just updating the terminology and getting rid of health promotion and calling that wellness. It's a little bit more of a contemporary term. Food safety remains the same. Volunteer and leadership development, pretty much the same, just getting rid of the end and putting a slash in there instead. Science or STEM, we want to now turn into STEAM and include arts in there. And some of the indicators we had already used arts in the phrasing there, so I don't think that will be too big of an issue for us. Farm, small business, family, and resource management was always a mouthful, so now we're calling that economic development. And then finally, we're going to merge the 2 more environmental issue areas, environmental impacts of ag and urban landscapes and the climate variability and change, into one as well. Climate change plan area has really been underused, and so I'm hoping that by putting it in with the environmental impacts area and changing up the outcomes and indicators, it will hopefully be a little bit more enticing for folks to start putting that into their individual plans. So that's going to be called environmental stewardship in a changing climate. So if you guys have questions on any of this, please let me know. Over the coming weeks, you should be hearing from your program leaders, and this will be showing up on program team meeting agendas. The deans from both institutions are going to be getting together and reviewing that matrix and the first draft of the revised plan of work August 28th. By September 30th, we want to hear from all of the program teams regarding what additional changes to our outcomes and indicators will be needed. So it might be deleting some things, adding new things in, reflecting some of those plan of needs assessment results, and maybe edits to wording and terminology that we use. We also talked about the need to identify some state level indicators that we then all focus on over the next 5 years. Maybe we'll change those year to year. So that's something we want the program teams to discuss as well, or what are some high level issues that everybody can report into. So then in mid-October, we're going to get those leadership teams back together again to review the final plan of work, kind of give it the final blessing and determine what kind of training needs we're going to need. In early November, program leaders are going to be asked to write issue statements for each plan of work area. And that was something we never did the last time. We really had just some bullets in those issue areas within the LAMPR system. And a lot of them, I think I ended up deleting because they were just long and made your plan incredibly long if that was included in it, and it really didn't add any content. I'll make all of the updates in Lampers in November, and then we'll probably just do some training on this and how this impacts your individual plans in December. So I know that was a lot. I went through that quickly. I hope everyone takes the time to read the report and really spend some time looking at the results within that and how that might impact your own individual plans and how you think our group plans should change. Are there questions, comments, thoughts? You can ask them out loud if you want, or type it into the chat box.
Jen, I just want to thank everyone for the great job they did in getting this out and getting the surveys out. We really did get a usable amount. The snowballing worked, and I know a number of you put a lot of effort into that, and that was evident through work there. I really am going to encourage the teams to really look at this. Some of the combination we're doing is because we didn't have indicators that we were really reporting on, and we really want to get these indicators down to what we're really using. So that's some of the work of the teams, as you mentioned, that we want the teams to do. So really be thinking about what things are you actually going to evaluate, what things are you actually going to ask people about, because we don't want to have indicators on things we're not going to follow up on that makes that the system bulkier than it needs to be and more cumbersome and less user-friendly. There's things we can do as we redo this that make it a more user-friendly system to do that. And then we're really, just comment that we're really thinking in December that we'll rethink about our plans. Jen, are we going to be able to roll over plans, or will we need to create new with these changes? Have you looked into that?
I'm not sure yet. I haven't heard back from Steve. I got an out-of-office reply.
Okay, so that's one thing we will have to look at to get further information, whether we'll actually start with new plans, which may be a good thing for us to stop and take a look at that and what we're doing and do that, or whether with the changes to it. My experience with the system is that we have to start new plans, but we'll see what we get with that. So that has worked. That will certainly need us to go back and do some training, and we'll have to plan that into our time frame for December.
Okay, well, thank you. I think we'll go ahead and switch gears now. I'd like to ask Maria and Lori to present for us now on the forum that they have coming up, the Health and Farm Vitality Forum. So Maria, Lori, go ahead and take it away.
Okay, so I guess I need to share my screen. Yes?
Yes, go ahead. You should be able to do that at the bottom of your tab there.
Okay, so. Is anything happening?
Yep, so I can see that you're, yep, it's full screen now. Good to go.
All right. Okay, so I'm going to start with a few slides to talk about the Linking Health, Farm Vitality, and Rural Prosperity forum that we are going to have in September, on September 20th in Dover. And this will just be a little bit of background on that, and Maria will finish with more information about it. So just to give a little background about the agriculture in Delaware, as an industry, directly employs a little over 10,000 workers, but about 30,000 in ag-related jobs. The average wage of somebody in agriculture compared to Delaware's average wage, generally speaking, is about $20,000 difference. That's information data from the Bureau of Labor Statistics. And then this is not necessarily just Delaware, but in a survey, a national survey done, nearly 3/4 of farmers between 18 and 64 had all farm jobs in 2016, just for extra income, but probably more importantly for health insurance. So that poses a problem because it takes time away from farming and sometimes even creates a need to hire another person to do labor on the farm. So there's a lot of issues around farm labor, health insurance, and farm productivity. So a few other statistics. Farms with principal operator ages, you can see here that the average age of a principal operator is about 58 years old. There are over 1,000 farms in Delaware that have an average a principal operator with somewhere between 55 and 64. Those folks are very close to retirement age. Health insurance will continue to play a part in as they retire. The young farmers, 25 to 34 years old, health insurance is going to continue to be an issue for them. So another reason why this effort is even looked at is farming is dangerous. It's one of the most dangerous occupations. And health insurance is seen as a major risk management tool for farmers. 3 out of 4 farmers and ranchers report that health insurance is important or a very important risk management strategy for their farm or ranch. Farming is very risky. Almost half of farmers and ranchers are concerned that they will have to sell some or all of their farm to address health-related costs, such as long-term care, nursing homes, or in-home health insurance. This creates an issue with intergenerational transfer of the farm, too. Some farmers, as they're approaching retirement, don't necessarily want to retire because they want to hold on to that land for this reason. 2 out of 3 farmers and ranchers report that they have a pre-existing health condition. With an average age of 58, farmers and ranchers are vulnerable to higher insurance premiums due to their age. And just over half of farmers and ranchers are not confident they could pay if they had a major illness. So that's kind of scary, thinking about that. And these are not just issues for farmers. We all have these concerns, but without health insurance or accessibility to affordable health insurance, this is a scary scenario. And with farms, the net income is not necessarily rising, but the cost of inputs is. So while they may have 2008, 2009, 2010, there wasn't much change in income, but the inputs for farms have increased. The cost of inputs. So I think Maria is going to take it from here and talk about how we're going to address what we want to do to address this issue. Okay, Maria.
There we go. That works better. So some of the statistics, thank you, Lori, for that nice overview. Some of the statistics that Lori shared are from a national survey of farmers and ranchers that happened in 2016. And so there was some good news out of that. 75% of farmers had insurance. And some of the things that we also found, though, is that it's really piecemeal. As Lori said, it's off-farm insurance that's helping to cover individuals who are working on farm. It's maybe connection into Medicaid or TRICARE, Medicaid being for low-income audiences, TRICARE being for veterans. And so they're kind of piecing things together and to kind of have affordable care. And one of the things that really also came out of that survey was the idea of, as Lori mentioned, not wanting to transfer the farm or let go of that asset just to ensure that there were assets available in case the older generation got sick. So it has not only implications for the farm and the farm kind of cash flow, what's coming in, what's coming out, but also, you know, what happens then to the transition of the farm, and in addition, sort of the economic vitality of the whole community, right? Because if the farm ends up being sold in order to cover medical costs, then what is then going to happen to that farm property and then the community around it? And so, you know, as many of you know, I've been part of this health insurance literacy team with the University of Maryland. Was involved in a project with Shoshone Inwood and Bonnie Braun, who were the chief principal investigators on that national health insurance survey. And we came back after that survey and after a similar project in Vermont and said, we need to do this locally. And so we applied for some funds from the Northeast Regional Rural Development Center. And our folks were, the individuals in the project are representatives from Maryland, Delaware, and Ohio. Shoshone Inwood, who was the key principal investigator on the Vermont project, has subsequently moved to Ohio. And so that's why Ohio is involved. And the idea was, can we replicate something that they piloted or they did in Vermont? And so recognizing that, you know, farming is a dangerous situation, recognizing that the profit margins for farmers is kind of low, especially with the higher inputs, and that the cost of health insurance really over the last 5 years has gone up. You know, another way to think about this is if their net profit is $33,000, their net income is $33,000, but they have to spend $13,000 of that for health insurance, then that's not much left for the family farm, other living expenses. So we put together a project to the Rural Development Center, and our hope was really to try to increase the understanding of the role of health insurance as it relates to risk management education, and to really get farmers, but then also the people who support them, to better understand the role of health insurance is in their risk management planning. And so to try to do some training around folks in the farming professional, as well as those who surround and support farmers, but also on the healthcare side and the health insurance side. And to try to get them to really think about, well, gosh, what would happen if our farms disappeared? And how would that really impact our communities and our access to fresh foods and produce? So it's about engaging and increasing the capacity for farmers and those who support them to understand the role of health insurance and access to care and affordability. It's about trying to get more people to think about, how do I integrate health insurance into my planning? And then really, you know, not just thinking about from the farmer's perspective, but what is the spillover into our community, the families, and then the economic development of the state. So, okay, Lori, I guess crunch the thing. There we go. So we started, we got the grant in November, and we started by doing some key stakeholder interviews back in January and February, just to kind of get a sense of, in Delaware, like, is this an important topic? Should we continue to talk about it? Is there any energy around it? And the answer, of course, was yes. We put together a steering committee, and so you can kind of see key collaborators listed there. Certainly the Department of Ag, Cooperative Extension, Mid-Atlantic Farm Credit, Rural Development, Farm Services Agency, Farm Bureau, Delaware Center for Health Innovation, Acela, which is an insurance broker agent organization that supports a small business, Delaware Rural Health Initiative, and of course, Delaware Center for Risk Management Education. So those are the folks on the planning committee. You can kind of see us working there in the picture. And we have been working very diligently to then create this opportunity for collective sharing and connection across different sectors. And so we're really trying to have and develop the discussion around having a statewide coordinated approach to address risk management with respect to health insurance and really health access for the farm, food, and agricultural sector. So, so to become, more effective and systematic in integrating health into agricultural extension programming, but also helping sort of those other organizational sectors within our community to better understand the role of agriculture and how they may think about and connect in with agricultural producers to help meet their needs. So, so the forum is really about bringing key stakeholders together and from a variety of sectors, from the health sector, ag sector, tax, finance sector, government, obviously extension, and to get them to kind of have a baseline understanding of some of the statistics and research base that Lori just shared with you, but kind of some more, right? And to then to begin to think about how can we collaborate and build bridges across those sectors to better serve Delaware farmers. And so here are, that's all right, here are some of the, we're kind of using an elite ecological approach, the community capital approach. What are the assets that we already have and how do we bring those together and have a conversation about kind of a healthy ecosystem for farmers and those who support them. And so, as I said, we've got folks from kind of the legislative branch of our government, from folks like from the Department of Health, from Public Health, from the Health Insurance, from the Insurance Commissioner, from healthcare providers, from business sector like SCORE and CPAs and estate planners, because it's so complicated. I keep visualizing this big knotted ball of yarn and how it's all interconnected, from estate planning and succession planning to health insurance to, how is a business even titled and how that impacts what their income is going to be, what they pay into Medicare and Social Security, but also how can they pay for health insurance and do they qualify for low-income subsidies? I mean, it's an interesting ball of wax, right? Ball of yarn. It's just kind of lots of different areas. And so we need as many brains as possible to help us kind of figure this out. And then also, how do we reach out and how do we help farmers make good decisions? And are there connections between these different organizations that will really put into play some good resources for farmers? So, okay, next slide. So, so that's what the forum is about. It's the beginning of those conversations, and we're inviting those folks. Our attendance so far is pretty good. We have about 35 folks signed up, all from those different sectors. There were a bunch of invitations that went out to my extension colleagues, and we hope that you sign up and are part of this. I think it will be important for people to connect to extension and recognize all of the wonderful resources we have, but then also for our colleagues to really understand the depth and breadth of this issue, so that as we try and go out and reach out and do some programming with farm audiences, that we have some a broader understanding of the issue. So there's still room. You have till September 1 to sign up. So please do. And for those of you who already have, thank you very much. It's great. We'll keep you posted. So phase 1 is really about the forum, and phase 2 is this professional development opportunity that will happen on October 24th. And this is going to be a national webinar, and it's called Strengthening Health and Farm and Ranch Vitality tools you can use. And so the focus here again is about what are some tools that we as extension educators and others out in the healthcare and farm risk management, tax folks, estate planning folks can use as they're working with farmers and help guide them in trying to manage their risk effectively when it comes to healthcare access and health insurance. Because, you know, the bottom line is if the farmer isn't there, the farm's not going to operate, right? So one of the most important pieces of, for lack of a better word, human capital, right, is the farmer. And if the farmer isn't there, there is no farm, there is no food, and there we are, right? So it's about how do we really get some information and tools out there for people who can support them. So put that on your calendar. Everybody's welcome to that webinar. And obviously, if you have more information, you can connect with Lori and I about this. I have to say, you know, with all of the outreach we've done, there is some resonating that's happening, and so I think this is we've hit a nerve. So I think it's important for all of us to be aware that as quiet and as prideful and as wonderful as farmers are, they tend not to reach out when they need help. And you know, that's a role that Extension can play in terms of trying to connect them to some good resources. So that's it for me. Thank you.
Thank you very much. Does anybody have questions for Maria or Lori right now? So I know you would like the extension folks to go ahead and sign up. And what about if they have other contacts or connections with people to, should it be forwarded or is it invite only?
So the forum itself is actually an invite only. We actually sent out maybe 200 and something invitations.
Okay.
But if you have ideas about that, I'm happy to entertain them, and send me, you know, call me, send me an email, whatever.
Sounds good. All right.
Thank you.
Anybody else? Sounds like a really good, important program. So I hope you have a good forum. I signed up, so I'll be there.
Yay, thanks, Jen.
Okay, so Michelle, why don't we go ahead and move over to you? I think you have some updates for us as well.
Yeah, just two quick things. It's time to do our Friends of Extension nomination. And Allison will be putting into the Directors Weekly today, I think, yet, the application and the information about the Friend of Extension. This is we have the Director's Friend of Extension Award, and we do recognize one or a couple, however this may be, from each program area, but a nomination from each program area for a Friend of Extension. These can be legislative people, they can be community people, they can be organizational leadership, but there is an application process, and it's a simple one. It's generally about a page and a half. The nomination form that we have suggests that you talk about their connection to Extension and then the impact of their work. So we are looking for those who have had some impact on Extension through their work. It is a special award. We will be recognizing these folks at our annual conference, and I think many of you are familiar with that. Those of you who are new may not be as familiar, but many of you are familiar. So I just want to encourage you. We've got the state fair under our belt now, and moving towards the end of summer, and it's time to get these nominations in. We're going to have them due by early September, and because we have to get things turned around, we have to order those plates that have people's names on them. We have to do those things. So all that information will be coming out in Directors Weekly today. But please, as your teams and be thinking about this, our program leaders will provide leadership for the team for those discussions and submissions. I encourage you to get those ready now, to be thinking about those. Take a moment. This is a great way to recognize our folks. We have had some success with those who've been nominated going on through Epsilon Sigma Phi to the national competition. And so we usually do select one to put forward and go forward to through Epsilon Sigma Phi to the national selection process. A great way to recognize our volunteers. So give some thought to that. Send your suggestions to your program leader, and let's get that going and get that nomination done. A simple process, important one as well. Recognizing folks is always an important thing to do. Finally, I just wanted to mention a few things about the budget. I don't have my final state budget number yet from the college. We have a working number that we're working with. And from the state budget line, we are holding the same on our state budget line that came into the college, and then dispersing that. We are going to have an increase in the line that will enable us to manage our salary increases in terms of percent for the salary increases that we receive. So that's good news in terms of the dollars that are coming. But the counterbalance to that on the federal side is that we have are receiving a 5% increase in what our fringe benefits costs for what we have on federal. So our federal fringe benefit rates are less than our state fringe benefit rates, so that's always been a good thing. But it is also now increasing. So it means that our dollars are going less far than they have going before. So that's a 5% decrease on all our federal dollars, because all of our federal dollars are on salary. We've moved our operating to state line. So I have some work to do. I'm working with Sarah Eastwick, who does our federal budget, and Allison Brayfield, who does our state budget, trying to pull this together. So I haven't yet sent out your operating. I anticipate that any major things that we take in operating will be to state lines, those that we have for our annual meeting, for our awards, for those kinds of things. I don't have any line of relief from the assessments we pay to the Northeast group or the national group. But we'll try and work on that. So as I said earlier, continue to work on your operating. I hope maybe today or within a week, because Allison's gone off vacation, to have a letter to you with your operating, and I'll be working on that today and confirming that and the numbers that go in that. For our 4-H coordinators, I will also work out, sometimes we have different numbers to give you for that. So we'll send letters that pay attention to those details of the operating dollars. So it'll be similar to what it is. We'll do the best we can to make this work as we try and manage with the 5% decrease in our federal. And of course, as always, we don't have our federal, so we have our federal. Our federal year begins October 1. You've heard, as well as I have, the conversations about the government budget. We don't have a federal budget, and we continue to have these kick the can things on our federal budget, and now we're to the next point in September where decisions have to be made about our federal budget. So that always is a little bit delay in our spending and what we have, as well as we wait for that to be finalized. So the good news is everyone receives some salary increase. I recognize it was not huge, but it was some, and thankful for that. And we are going to be receiving state dollars that will enable us to account for that. We don't receive state dollars that account for all of our promotion and increased costs that we have. So it really is a balancing act here of seeing how we're getting. And we do have some relief that's coming as we're having conversation, particularly about the amount that we're spending in operating dollars around Kent County office, and that's different from either of the other county offices, and whether we can have some of that go to base budgeting, and trying to make that case as well to get some security around that. So we're in the process at some of the highest levels of the university to make those changes. So the important thing for you is operating, continue to operate and count on similar dollars to what you've had. I think it'll be very similar as in the past. and we'll have letters out to you in the next week or so.
All
If
right.
there's any questions about that, I'd be glad to respond to that.
Well, thank you, Michelle. I think that's great news. I'm definitely happy to hear that. The only other announcements I wanted to make, and I had put it in last week's DW and I'll repeat this week, our Extension Scholars have their symposium next Thursday. So we have 9 of them who have been working with our colleagues across the state. So at the celebratory symposium for research and service, all of our scholars will be either giving a poster presentation or an oral presentation. And so if you're going to be up in Newark on Thursday and you have time to try to swing by and see at least one of them, that would be great. I think Michelle and I are going to try to make it to all of them, or divvy up as many as we can. So please do that if you can. And then I think Allison gave me an update yesterday that we were doing really good and looked like we had almost all of the expected responses in. But if you have not yet voted agents and specialists for your ag or hort representative on the peer review committee for promotions, please go ahead and do that. She sent an email out last Friday. We want all responses in by the end of the day today. So it looked like we were pretty much at what we expected, maybe one or so more. If you think you're in that group, you need to check your email. So we're looking for responses from agents and specialists. And I think that is it. Our September 1st Friday will be on Friday, September 7th. So it'll be the Friday after Labor Day. And Lori will be back. She's going to talk to us a little bit more about the Northeast Extension Center for Risk Management. They'll have an upcoming grant opportunity in the fall. So she's going to tell us about their program and what we could expect if we're interested in looking into that grant opportunity. And Michelle, also, I had put in the DWs that we might also have an update on ag law. Did you want to talk about that quickly too?
Sure. So we have ag law, we have a memorandum of agreement and a payment that I make to University of Maryland for ag law. And Kelly Knuckles has been the faculty member who has worked from Maryland and has done a number of things for Delaware, updating some fact sheets and some information that we have for ag law. Kelly has resigned and is leaving Maryland. And so Paul Geringer, who runs that program at University of Maryland, and many of you know Paul, he's been around. He and then another member of their team will fill in for through the end of the year when I have this MOU for the work and continue the work of Kelly Knuckles as we move forward. And I imagine that they're going to open that position and have another search process for that. So Kelly has done just a number of fact sheets since she met with the ag team and has developed a number of those. I will share with the ag team leaders that they can share with the team just what all those materials are. And then Paul will be happy to come to the ag team meetings and represent the ag law program and continue the work as we plan to just the continuation of the ag law piece. So I think it's an important part for us. It adds to our program, and so looking for continuation despite this retirement. And then as I know Jen has announced in the Directors Weekly, we do have a new staff member coming on, Alyssa Kohler, who will join us in October and complete our team at Carville from the ag side and the plant and the area of plant pathology. And so everybody stay put, and we'll have a full staff. We'll be fully staffed and everybody in place for the next couple months. So pleased about her joining us and those things getting finalized, and for everyone who was involved in that process.
Okay, great. Well, thank you, everyone. Thank you, Maria, Lori, Michelle. We appreciate the presentation and all the updates. I hope everyone has a great Friday and a good weekend and a great August. See you around.